Hello everyone and welcome to Module 7. This week we are focusing on the opposite end of what we talked about last week. So last week we talked about pediatrics. This week we're talking about geriatrics. And for this week, there are no procedures that we're going to focus on. Instead, this week we're going to be working with and talking about externship and externship orientation. I'm also going to have you guys working on some things in the classroom itself. So there's no actual procedures, but we will be doing quite a bit that day. So what I want to do is spend a few minutes and really kind of just discuss the topic of geriatrics and what that means and really what your role as a medical assistant is within geriatrics. Working with and providing care to the elderly population requires specific considerations. You need to consider ways to support their physical and emotional needs. One way this can be done is with effective communication. Proper and effective communication with the geriatric population centers around calm, relaxed, and respectful interactions. 4 things that you will need to keep in mind when communicating with geriatric patients. First, do not be hurried. Rushing through things will pose a risk for errors, but it will also send a message of unimportance to the patient. Number 2, speak clearly and slowly. Make sure that you are clear and to the point. Speak slowly, but not so slow that you will cause offense to the patient. Number 3, make eye contact. Many geriatric patients will consider eye contact a form of respect and confidence, so make sure when communicating with them you do make eye contact. And lastly, number 4, avoid pet names. This is one of the most irritating and annoying interactions to patients of all ages. So please avoid using things like sweetie, honey, or dear. Another topic that will need to be discussed is the topic of the aging process. Now, the aging process is a continual progress from birth and ending with death. And it's important to know that there are many factors that will impact how the body ages, including lifestyle choices, occupations, occupational hazards, nutritional choices, healthcare services, and the physical and social environments in which we put ourselves into. One thing that you need to pay attention to is the term ageism. This is referred to as a prejudice against or the incorrect assumptions about an individual or individuals because of their age. Awareness to the aging process will help increase the respect and empathy the elderly patient receives. Another topic that we need to discuss is physical changes that happen with aging, and they relate to each and every body system that we have. When you are rooming an elderly or older patient, you must document accordingly and report your observations to the physician for immediate evaluation. The systems that you will be able to notice a physical change on would be things like the integumentary system, nervous system, sensory system, musculoskeletal system, and the respiratory system. But there are some changes that you may not see, but they do have physical changes. Things such as the urinary system, digestive system, cardiovascular system, endocrine system, and the reproductive system. Now, there are not only physical changes that a patient will go through with aging, but also mental changes. Mental deterioration is not a normal part of aging, contrary to belief. Mental health is the ability to cope effectively with life changes, manage life stresses, and achieve a state of emotional balance. In order to maintain good mental health, individuals must participate in activities that they find both interesting as well as engaging, and they need to engage in regular social interactions. There are a few areas that, as a medical assistant and as medical professionals, you need to pay attention to. For instance, we need to make sure that we're paying attention to cognitive ability. This is the ability to think clearly, reason, and perceive. Normal aging does not reduce cognitive ability. Now, one thing that does fall under cognitive ability is memory. And memory can either be short-term or long-term, as well as sensory memory. Many things can affect memory, but the biggest could be that of medication. For example, if a patient is given the wrong amount of medication, is given a medication at the wrong time, or if a medication is skipped altogether, it can cause issues with memory. We also need to pay attention to confusion. This is a term that is used by physicians and healthcare professionals to indicate that a person cannot follow a conversation, answer questions appropriately, understand where he or she is, and remember important facts or make safe judgment calls. Confusion can be acute or chronic. You also need to pay attention to if a patient could have depression. This is defined as abnormal or persistent moods characterized by sadness, melancholy, slow mental processes, changes in eating or sleeping habits. And medical depression is confirmed when 5 of these symptoms have been present daily for at least 2 weeks. Oftentimes, depression is overlooked in the elderly, or it's misdiagnosed as another part of a problem such as dementia. So if you think that your patient may have depression, please make sure that you're bringing that up to your providers right away. The other thing that we need to pay attention to is that of having dementia or Alzheimer's symptoms. There are 2 other mental changes that can happen. But because we talked about these in your Clinical 1 course, I am not going to go over them here. Please make sure that you review dementia and Alzheimer's and ask any questions if you need to. The last thing that I want to talk about that's of great importance is that of making sure that we're watching for elderly abuse. Abuse of elderlies by their family members or caregivers may occur at the home, in an institution, and has many different forms. It could be things such as stealing the patient's belongings, inflicting pain or injury, mishandling monetary funds, withholding care such as food, drinks, or medications. It could be sexual abuse, threatening or confining a patient. And as a medical assistant, you must be alert to all the signs and symptoms of abuse, and all cases of suspected or known abuse must be reported. Now, one last topic that I do want to discuss is patient education, specifically as it relates to the geriatric patient. It is important that when you're teaching an elderly patient that their intellectual capacity, and you know this, does not diminish, it merely changes. So that means the education will have to change also. Some changes that take place as a person ages as they have things like slower processing time. It is helpful to break down material into smaller units and take time to explain each item on the list. Don't skip anything. They could have a decreased short-term memory. So your older patients will often have an easier time remembering the past, but they'll struggle with remembering newly acquired information. This can make the learning frustrating for not only them, but also for you as the teacher. When it's possible, try to link new material to a well-known past experience So that way it starts to make more sense and they can actually start to remember it. Patients may also have a decreased dexterity or mobility. This could be due to arthritis or other physical changes. So think about the fact that the elderly patient may not be as physically able to do some of the things that they could when they were younger. And when possible, make sure that you're using any DME, which is durable medical equipment. Things like canes, crutches, walkers, wheelchairs, shower chairs, oxygen if it's needed, all of those are considered DMEs. And lastly, there's an increased anxiety about new situations. So as an advocate for your patient, you have to help them by encouraging and building up their confidence levels. Practice positive reinforcement and provide encouragement when they display an understanding of a new concept. All right, guys, that is what I have for this week and the topic of geriatrics. Again, we have no procedures this week. What we're going to be doing more is focusing on externship and getting a lot of those questions answered about externship. So if you do have any questions, please make sure that you are bringing them to the lab. I look forward to seeing you all on Tuesday. Bye, everybody.